So, here's the real question. How do dentists like you, who aren't willing to let insurance dictate how you will run your practice, who want to create incredibly profitable practices without sacrificing your time or sanity, how do you create the strategies to ensure your practice not only survives, but thrives in the 21st century? That's the blaring question, and Dr. Steve Schlintz is here to provide the answers. Welcome to Dental Practice Freedom Radio.
Hey, what is up, everybody? This is Dr. Steve Schlintz. I want to welcome you back to another episode of Dental Practice Freedom Radio. And I think it is April 29th, which means we are probably 2 to 3 weeks away from most of you opening back up in your practices and ready to launch and roll, which is so exciting. I will tell you that, after a month and a half now of being in quarantine and being isolated to the house, I'm ready to get out. I've actually been doing a ton of coaching. I'm busier right now than I've ever been with existing clients, new clients, different avenues, different ventures. I'm just it's humbling for me to be able to help in the ways that I can help right now. And as a result, one of the things that kind of got put on the back burner is this podcast, unfortunately. And that's, if you guys have been listening to this podcast now for the last couple of years, which it's crazy to think that this podcast is 2.5 years old or something like that. But you know that's kind of how it goes. If it gets really, really busy on client fulfillment, I tend to, put this podcast off a little bit. If I'm trying to promote an idea to you guys, then I'm going to use my podcast. This is my number one form of media to connect with you guys. So I still love doing it. It's one of my favorite forms of communication, just because it's so raw, it's so real, and it's so in the moment. It's not something where I rehearse my podcast episodes. Is literally I record, I stop, I put the intro on the podcast, and I go with it. I don't edit. I don't go, ooh, I didn't really like that, I'm going to stop and re-record that. I just don't do that. If it's not good, I'll get done and be like, oof, that probably wasn't the greatest. But stream of consciousness, I think, is very important in a podcast because it really expresses and conveys emotion. And the thing that I wanted to talk about today, actually, is how are you doing your virtual consults? And what does that actually mean? And the reason I wanted to bring this up is because this is such a hot topic right now, and we're going virtual, and we're doing this, and we're doing virtual consults, and that's the rage, and that's fantastic. I'm not seeing as much of it right now because now dentists are starting to get back in the practice, and I think that short-term pain that they had is going to be gone, which is, we know something's going to be different, but maybe we didn't implement the system. Anybody that tells you can go completely virtual as a dentist and start to do virtual consults in 2 weeks, it's not true. You actually have to change your entire structure around to be able to do it effectively. I'm not saying you couldn't set up a portal and maybe get like one patient every 2 or 3 months that comes in through that portal, and they send you a photo of your teeth and of their teeth, and you go back to them, and maybe they move forward. But anybody that's really successful in that space, they've kind of built their entire practice around that form and medium. And so what was interesting, though, is I actually got an email from a potential patient just the other day. And this patient was actually in the Tampa, Florida area. And when she would have heard about me, I would have been in North Carolina at the time. But even so, she's reaching out, and it was through a podcast that I did with a chiropractor. So this chiropractor has a podcast called The Unleashed Human, and her email is so good, and I wanted to read it to you guys. And I'm going to save her name just in case, I don't want to pin it back to her. But this is the message. This came from a subject titled Dentist Referral TMD TMJ. This comes from Sharon. Her name is protected for identity purposes. But the reality, her name was Karen. That's close enough. I won't tell you her last name. Karen says, Dr. Schlintz, I was reaching out to you after listening to a podcast dated March 4th, 2019, titled Eliminate Jaw Pain, Clicking in Jaw, Grinding Teeth, and Headaches on the Unleashed Human between you and Dr. TJ Woodham. I went and got a bifrontal craniotomy and CSF leak repair to remove 4.5 centimeter olfactory groove meningioma in September of 2017. My incision was from ear to ear, and titanium plates were inserted to heal. Since this surgery, I've suffered from all the pain you mentioned in the podcast: neck pain, ear pain, headaches, shoulder pain, intolerable flare-ups, come without warning. I've been through all the doctor-recommended therapies: physical therapy, massage therapy, teeth grinding, night guard, and the only thing that has seemed to help is restorative yoga by a neurologist. I do not wish to solve this issue like a disease, for example, being on pain medication, but rather to get to the root cause of the issue and treat appropriately. Your interview spoke to me. I'm interested in more information about your orthotic, blah, blah, blah. She goes on to talk about where she's from, and if I can't help her, maybe a dentist in her area can. Thank you for any resources you may pass along. This patient may not be looking to have me treat her or not, and the reality is I probably would not treat her at this point. And Karen, if you're listening to this, thank you so much for the email. I told you that. You're probably not listening to this. I wouldn't recommend you listen to a dental podcast. But the reality is, when you're doing a virtual consult, like we can say we do virtual consults, but the main point that I want to bring up to you is, how are you speaking to those patients that are potentially going to book with you virtually? What's coming out? What's being conveyed? When I see something like your interview spoke to me, I've always told my clients, listen, you have to know your patients better than they know themselves. You literally have to get to a point where they go, how did you know that? You know, if you can look at their face and know they have headaches and say, how many headaches do you suffer from every week? How do you know that? If you can clearly identify their problem, then they're also going to look to you for the solution. And that is a very powerful message. So if you're in the virtual world, maybe you're trying to figure out, how do I get more patients like Karen? Part of it is the process of bringing them through virtually. But more importantly is the message, and how is it getting conveyed to them? How are they hearing it? You know, I did that podcast episode on March 4th of 2019. This is now April 29th of 2020, over a year ago. But podcasts are great. YouTube videos are great. Things that stay relevant, that actually get more searched over time because they have traction, are great places to start. And so the power of this is, now if I take Karen, I could take her through a virtual platform. I could get her on a Zoom meeting. I'm going to do a 10-minute call with her. I said, listen, I don't know if I'm going to be able to help you, but I'd love to get on a phone call with you for 10 minutes. If I can't help you, I'll try to find somebody who can. Now, I know I'm not going to spend a tremendous amount of time going out and looking for other dentists that can treat Karen. But if I get on a phone call with her and say, hey, Karen, this is kind of where you might be at, where you could potentially go. I'd love to be able to help you. I'm up in Philly. If you want to come travel up here, I'd love to take a look. But I'm not gonna know for sure until I get on a call. And even if she took the traditional virtual consult, like the pictures, and then she sends them in to me and I give her a treatment plan, that's not what Karen needs right now. That actually would be a terrible idea for Karen. Karen needs somebody to actually walk her along this path and say, listen, I understand where you've been. It sounds like you've been through physical therapy, massage therapy, and you've done everything they told you to do, and you're not getting relief. We need to start from the base level, actually see what's going on, and work our way up from there. Most people don't understand that. Most dentists don't understand that. For a patient like Karen, you treat them different because they've been hurt. And it's not that they didn't have to remove it. They did. Like, whoever took out the meningioma, like, they had to do that. But now she's dealing with this residual pain, and if there's something we can do to help, that's great, but I got to take her on this process. And I know that because I've treated enough patients that are like this to know what that's going to look like, and to know the difficulties that we're going to run into and the problems we're going to run into, and be able to tell that to them before we ever start. It's going to make sure that I am always seen as the authority and the source in a case like this. That's what I teach my clients to do. If If you're a dentist right now that's listening to this and you are struggling with how do I differentiate myself in the market, but I have high clinical skills. I've been to Dawson, I've been to Coyce, I've been to Pankey, I've been to Vivos now. I'm learning airway stuff, but I have no way to get my message out. This isn't for me to sound boastful, but because I understand the message so well and I can convey it, I will probably always have more patients than the vast majority of dentists that are in this space because of my marketing. And it's not marketing like my website. It's understanding the content so well and being able to speak and understand where my patients are actually congregating, my potential patients are actually congregating, so that when I speak to them, they go, that resonated with me. I've never heard a dentist tell me that before. I actually remember doing this podcast interview with Dr. TJ, and he said, after the podcast, he's like, I've never heard a dentist talk about TMJ like that. Like, that's incredible. The reality is most of my clients actually know just as much as I do, if not more. But they haven't taken the time. Well, they should be taking the time. They're the clients, right? Like, dentists don't take the time to understand how to package their message in a way that resonates with patients. And that's what I've been focused on with clients now for 5 years, is how to figure out how to get out of this sea of competition, create your own market environment, so that these patients come to you and say, listen, you're the one. I want you to treat me. That is a cool place to be in. I love talking to people like Karen, even if I know I can't help her, because I know I'm going to be able to find somebody that can help her. And she's going to have a much better understanding of what's possible in dentistry than if I never speak to her, if I never get my message out. The time's now, guys. So I hopefully you got value out of this podcast today. You know, when you're starting to go virtual, think about, what am I trying to say when I go virtual? Because even in the virtual world, that's how I get the majority of my dental clients, is actually through Facebook ads or this podcast. I don't go out and bang doors and talk to dentists all day. I'm using these media to get the message out, and the right clients find me. The last 4 clients that I've had that came through this podcast have been absolute rock stars. Absolute rock stars. And it's because I've learned my message so well. I'm so committed to helping dentists create wellness and comprehensive-based practices that work for them, that people that come to me, they're like, yeah, I want that. That's what I want. I understand you've articulated my pain points so well that that's what I want. I want you to be able to do that in your own practice. That's the point. So with that being said, hopefully you guys got value out of this one. Thank you so much for being patient while I've been waiting to update the podcast, but hopefully this one was worth it, and I'll see you at the next one. Take care.